is Michigan Matters with Carol Kane.
We're going to dive in today by focusing on a major health epidemic, often a silent one that people don't realize they have. Diabetes. With us is Natalka, who is a nurse and a BSN and also a diabetes ambassador, and Ronell Carr, manager of Mission Delivery, American Diabetes Association. We know November is Diabetes Awareness Month, and Ronell, the statistics on this, particularly here in Metro Detroit, are rather staggering, aren't they?
They are. Currently, there are over 300,000 people with diabetes in Detroit. So the statistics are very high and will keep growing if people don't start making lifestyle changes.
And Natalka, you people may recognize you. You are a famous dancer here, and you do a lot of dancing to help raise awareness for diabetes. And talk a little bit about that.
Yes, Carol, actually, my Dancing for Diabetes initiative is all about education and empowering patients to find an activity that can get them moving, doing something different. Could be ballroom dancing, as it is in my case, or something else.
I know you've done Dancing with the Stars.
Yes.
In fact, you danced with Brooks Patterson a couple years ago.
Yes.
People still talking about that. So, well, let's continue the conversation here, Ronnie. With diabetes, we know a lot of people are predisposed to getting that. What kinds of things, which again, we're here in the holidays, a lot of eating, holiday, festive eating, things that maybe aren't so good for you. What kinds of things can we do to try to help prevent it? What kinds of, if you had to give a few quick tips?
I would say to prevent diabetes, you definitely want to get educated on diabetes. Speak with your doctor regularly. Also talk with a certified diabetes educator. And then start to make healthy changes with your physical activity as well as eating healthier.
So also, Natalka, I know there's you work with Novo
Nordisk,
which is a diabetes company that provides education and products for that. They have a quiz you can take that kind of helps tell you what your predisposition might be for it. Or,
yes, absolutely.
And it's the website is doyouknowdiabetes.com.
Yes, in fact, I took the quiz yesterday myself, and it was very educational, and everyone should go on. And it's a quick 10-question quiz, very easy.
So, what 1 or 2 questions or whatever will people know? You maybe should go see your doctor if you're having these kinds of symptoms.
Well, exactly. I mean, some of the things that they go over are just some of the basics as far as activity, blood sugar, what types of things you can do for prevention, and obviously always going to your physician, diabetes educator, as Ronell said. These are the most important things you can do, is just seek out the information.
We know that the numbers, again, are going up. In fact, it's going up by 23% between 2010 and 2015, according to some of the Diabetes Foundation statistics on it. That's rather staggering.
It is. And we just encourage people to get themselves educated and make the right decisions. 30 minutes a day can make a tremendous difference in your physical activity and your management of diabetes.
Well, there's also different types of diabetes. There's the type 1, which is what you're born, some people are born with, and then type 2, which is more of what we have come to think of as a middle age and later disease. But aren't we seeing type 2 diabetes showing up in younger people?
Yes, type 2 diabetes is not just for obese people. It is a lifestyle disease. So you can get it from culturally, having someone in your family that is predisposed or has had diabetes, or just by not eating the proper foods and not being physically active.
So we're talking about staying away from salty food, all the things we like to eat, the salty foods, the things with starch, sugar.
Foods. You can visit our website at www.diabetes.org. We have meal ideas and healthy tips for the whole family.
And Natalka, I know this disease impacted you and your family and kind of led you to get involved in diabetes, right?
Yes, in fact, I mean, all of us sitting here today are in the place where we have a family member or a friend who's been affected by diabetes. My grandmother had diabetes, and I think everyone can think of someone who has. So it means something to everybody, and so it's important for all of us to be involved, and I think that's why we're here today.
And as far as testing, we know that some diseases as diabetes are more pronounced in minority communities, African American, Hispanic, and others. Is this something you should have a blood test every year at a certain age, or what kinds of things do you suggest?
You definitely want to talk to your physician. It is different for everyone. If you are having symptoms, then of course that would be more of a reason to go and have that conversation with your doctor. If you're not having symptoms, you may still want to have a yearly or annual test done.
As I mentioned at the get-go, that this is often a silent thing. People don't realize they have this disease until they go and then they get their blood sugar checked, and it's, oh my goodness, I've got diabetes suddenly. So is it something beyond a certain age they recommend you should have a blood test done?
Once you reach the age of 45, you are at higher risk So we do recommend at the age of 45 of getting that annual test done.
And so, Natalka, you get the final word on this. As we sit here, you talk with dancing, which is a wonderful exercise, and being active is helping and preventing it here. What other things would you recommend to someone maybe who isn't going to dance? What other things can they be doing to help avoid getting diabetes?
Right. Well, that's the question. I mean, maybe not everybody wants to take up ballroom dancing like you and I did.
Live to tell about it. Still have blisters on my feet.
Exactly. However, there are plenty of other activities such as kickboxing, yoga, Zumba, and simply just adding on a walking regimen after you have dinner or lunch will help to lower blood sugar. And I think many of the viewers don't realize that just simple activity can help lower their blood sugar.
Just keep walking, as the saying goes
Exactly.
here. Natalka, Ronnie, thank you so much for being here. Appreciate that.
Thank you for having me.
Okay, keep it right here. We're back with more Michigan Matters right after this.